I'm going to tell you something you probably don't want to hear. There is no one exercise to fix all of your SI joint issues. The reason is this. There are too many muscles that influence the SI joint. You have muscles that go from the neck that attach to the pelvis. You have muscles that go from the rib cage and the spine that go to the pelvis. You have muscles that go from the legs and attach to the pelvis. Any of them can influence the position or your posture that you find your body in, which then can put the SI joint in a painful position. The good thing is this, if you understand the underlying issue, which is asymmetry, the right side of the body and the left side of the body simply are not the same. And when you have SI joint issues, as long as it's not coming from hypermobility or like an actual injury to the SI joint rather than just pain, once you understand asymmetry, the underlying asymmetrical pattern that's found in the body, it's much easier to conceptualize how to fix SI joint problems. I have a lot of personal experience with SI joint pain because I lived with occurrences, blowouts of my SI joints on the right and left for about 14 years. And it would happen about 3 or 4 times a year from my sophomore year in college until I was 35 years old when I found postural restoration. Now, when you see how SI joint problems occur from a PRI, from a Postural Restoration Institute perspective based off of asymmetry, it makes things a lot easier to understand. So here's the big picture. When someone is having SI joint pain, you don't treat the SI joint pain itself because pain is just a symptom and you can't treat a symptom. You have to treat the underlying position of the pelvis and the position that the SI joints are being put into based off of inherent human asymmetry. So you treat the pattern of asymmetry and you treat the position of that asymmetry to resolve the SI joint pain. Additionally, towards the end of the video, I'm going to show 4 or 5 postural restoration techniques that can be used to help someone to start to restabilize their SI joints. Now, because there's no one exercise for every single person, it also means, by extension, there is no one set of 4 or 5 techniques that will work for everybody because people are in different positions. Some people are very, very flexible. I would not approach the very, very flexible person the same way that I would approach someone who's basically really, really tight and stiff. They're in different, their nervous systems are in different states of existence. You can't treat everybody the same way. That's why there's no one PRI program for every single person. The techniques that I'm showing will illustrate the concepts of what needs to be done to start the process of restabilizing the SI joints. Now for some SI joint basics. First of all, the SI joint is not fused. People make that mistake all the time. It doesn't have a lot of movement available to it, and it is wound up tightly in ligaments to support that SI joint, so it doesn't move excessively. But it does have movement. I found some numbers, and it said that it has about 1 to 4 degrees of rotation, which admittedly is not a lot, and it has about 1 to 2 millimeters of translation. What that means is these SI joints on the right and the left, the spine comes down, forms the sacrum, and the sacrum is what attaches to the ilium. So you've got the SI joints, sacroiliac joints on each side. They transfer motion and power from the lower body to the upper body and the upper body to the lower body. So I did a video last week or a couple weeks ago about the spinal rotation and these central pattern generators that are found in the spine that make walking automatic. That rotation through the spine drives the pelvis from side to side as we walk. And thus, to have appropriate pelvic motion, there has to be movement. I am absolutely exaggerating the SI joint movement at this point in time, but this is what occurs. As one side goes forward and out, the other one goes back and in. And it's that alternating activity that produces the walking motion and also stance and swing phases of walking. Now I have here a study, and it's called The Efficacy of Pelvic Repositioning Exercises on Pain, Hip, and Shoulder Range of Motion and Disability of the Patients with Chronic Non-Specific Low Back Pain. And what they found was that using postural restoration repositioning techniques are an effective treatment to reduce chronic low back pain via improving pelvic alignment. And then they also found improvements in left leg adduction and internal rotation. And that is which means that will influence the position of the pelvis and the SI joints themselves. And that is because humans, because of our asymmetry, often end up in a position where the left side of the pelvis is forward and the right side is back as the pelvis orients to the right. Now, how do you know somebody is like that? And why would they be there? Well, because first of all, this whole channel is about that. Humans are right dominant, and humans prefer to kind of, like this picture shows, humans like to hang out on the right leg a lot. Yes, I know some people say, no, I have my weight on my left leg. Doesn't matter. Your pelvis will still be in the same position. Over time, because of getting stuck over on the right side, when you put your weight on your left leg, the pelvis never actually turns to the left. It stays oriented to the right in this same left AIC, this left AIC pattern. Things can start to get weak, especially the front of the left hip. So when the front of the left hip starts to get pretty unstable, you can have repercussions in the SI joint. Also, when you're over on that right side, certain muscles, predictably, will start to get tight because the pelvis is always in that same position, because the pelvis is suspended in tissue. It's suspended. The bone is suspended in muscle. It's suspended in fascia and other connective tissue. So when the body moves, it has to move. But when the body is not moving properly, muscular tension from a lot of different muscles, like I'm going to show, can start to influence the position of this pelvis. You're going to be in this left AIC pattern with the left side forward and the right side back. But where the primary influence is coming from, you don't really know. The good thing is you don't have to know, because you treat the pattern of asymmetry. When you treat the pattern of asymmetry, that is what relieves the tension on the SI joints. So when you lie someone on their side and their right leg does adduct, but their left leg does not adduct, that is the left AIC pattern. That's how you know you're in this patterned position, which can put stress on the SI joints. Now we're going to look at a sampling of muscles that are often indicative or are often involved in SI joint pain. Of course, you're not going to be able to narrow down to exactly which one muscle is the problem, because it's not one muscle, it's an overall system of asymmetry. So here, you have the psoas and the iliacus and just hip flexors in general. They will all, they rotate the spine, they rotate the legs, and thus they will move the pelvis. Now turning around, you could have a right lat, because the right latissimus through the thoracolumbar fascia attaches to the pelvis. There's a huge influence of the right lat on the pelvis, on the right side of the pelvis, on the right SI joint. Even how you use or don't use your arm will dictate what is going on with that right lat, and thus how you use or don't use your right arm could influence the SI joint. If you're a pitcher, you might have to think about that. Or if you just do a lot of things with your right arm over you. Then on the left side, you have the left QL, and you have the left lower back extensors. And there's more. I'm just showing a few of them, but there's more of them. And you can see that they actually go all the way up to the neck. So if someone has a forward head posture, a forward neck posture, that will misposition and induce tension into these left back extensors that can run all the way down to the left SI joint. So it could be any of those two muscles. Now, on the ilium itself, you could have a left iliacus that is weak. It's no longer helping to stabilize the pelvis on top of the leg, on top of the femur. You could have a left TFL, a left hip flexor, that's overactive in internally rotating the left leg because the anterior glute medius on the left side has gotten weak. Which one is it? You don't really know. Hamstrings might have more influence on the SI joint than any other muscle, because they are what support the pelvis from below and allow for a lot of this pelvic rotation as we walk. On the right side, it's usually overactive. On the left side, it's usually underactive, and that just goes with this normal left AIC pattern. That's why one of the techniques that I show at the end is going to be for the left hamstring. Now look what else attaches to that right ilium and thus influences the SI joint. The right glute. The right glute is often very underactive as an external rotator of the right leg, while the hamstrings on the right are often an adductor on the right. So hamstrings and adductor are often overactive as internal rotators. So you could be having the right hamstring and the right adductor could be overpowering the right glute because of the position that your pelvis is stuck in, and that could also be causing SI joint pain. But again, the good thing is you don't care. There's a basic pattern of activity. You don't have to treat each individual muscle, you treat the pattern. And then finally, here's just kind of a brief overview. The body is shifted over to the right. You have the whole right side that's overactive, right abdominal wall, right chest wall, it could the right pec minor, the right lat, the right adductor, the right hamstrings are all conspiring to hold you over on the right side, while on the left side, it's often the left psoas and TFL that are overactive, holding that pelvis forward on the left. So overall, what we're trying to do is we're trying to inhibit or tone down the anterior neck through this sternal positional stretch. The right torso, we're trying to expand the right torso with air through the side-lying rest position. You're trying to expand your left posterior rib cage with this standing wall push or wall press. You're trying to inhibit or tone down the right lower hip, so basically your right lower butt area, right inner thigh. It's called the inferior glute max inhibition. And then you're trying to facilitate on the left, that's all on the right side. On the left side, you're trying to inhibit the left hip flexors, the left psoas, which then allows you to facilitate the left hamstring and the left adductor. Like I was saying before, all of those scenarios that I was talking about, the left TFL, the left iliacus, the hamstring imbalance, what the right glute is doing or not doing, all of that is probably going on. And I need to know that as a practitioner, and I do know that. But the techniques that Postural Restoration has put together are all addressing this because it's just a position that the body's in. It's very predictable. If you're stuck over on one side, it's very predictable as to what those muscles on the right side are doing or not doing. And then it's very predictable what the left side is doing or not doing because you're stuck in one half of the gait cycle. So you treat the pattern. To resolve SI joint pain, you don't treat the SI joint pain. You resolve or you treat the pattern that is causing the pain. If you are new to this channel, I am a credentialed Postural Restoration Institute provider in Chatham, New Jersey. That's where I do my in-training session. I also do some online consultations, and the links are in the description. On my website, there's also a free download about the science of postural restoration if you want some more background. If you like this video and you think it's important for other people to know this information, could you please like it, share, comment, or subscribe to the channel? I'd appreciate it. Now here I'm going to show some videos and just show some pictures of postural restoration techniques to explain the overall concept of how I would address someone with SI joint pain. And now remember, like I said, I had SI joint pain blowouts for 14 years. 2, 3, 4 times a year. It was misery. You never forget where your first SI joint blowout occurred, and mine was my sophomore year in college. I'll never forget it. It was on the left side. The pain was so intense, it was just shocking. So if you're in an acute stage of SI joint pain, I would not really want anyone doing anything at that point until it subsides enough that you can start to get into these positions comfortably. But let's say someone has a little bit of an ache, but they're not like in the death throes of that SI joint pain. How would I approach it? Well, first of all, because I know there's going to be a breathing influence on this SI joint. In postural restoration, it's brain first, breathing second. The brain has to figure out where you are, and it positions you over to the right. We have to learn how to go to the left. Underneath that, though, is still the autonomic nervous system and breathing. So someone who's been in a lot of SI joint pain, they're going to be in a fight or flight type of state. Their sympathetic nervous system is going to be driven up. They're going to be not feeling good. So if I can reduce their reliance on neck breathing, which they will be doing to one degree or another, the moment you can get their diaphragms back into their life and reduce the neck breathing, well, their fight or flight is going to start to come down immediately. Now, it's not going to say it's going to resolve the pain immediately, but they're going to get into a more rest and digest parasympathetic state. So what would I do? Well, because I have testing that will show whether their neck is tight or not, and it's highly likely that it will be, I could do something like this. It's the sternal positional stretch. I made a video about this. The link will be in the description. This technique, I used it in a video about why desk jobs and computer jobs cause forward head posture and really mess things up. That is an easy technique. You just elevate your legs, You lie on some blankets, so you're elevated slightly. Your head is behind your torso. Arms are out to the side. If you're hypermobile, I would not do this, or I just keep my arms at my side if you wanted to try it. But as long as you keep your back flat as you're breathing, as long as your back stays flat, I cannot stress that enough. Your back cannot arch when you take a breath in. Your back has to stay flat as you breathe. That will allow your chest to expand, your upper chest to expand. Not this, not that. That's neck breathing. That's lower back extension. That's extension-based breathing. That's what's contributing to this problem. Our rib cage needs to expand forward and back and side to side, not go straight up. When you can do that, you will start to use your diaphragms again. Now, we're really looking for the left diaphragm because most people are still using the right diaphragm more so than their left because of the asymmetry in the bigger right side. That will, if you can reduce that neck breathing, that's also going to reduce back tension. That's going to reduce the overactivity of those back extensors, which I mentioned earlier. So that's how I would start people. I want to drive down their sympathetic fight or flight response, get their system more under control, get the neck to let go, because the neck also keeps pulling the chest up into extension. And as the chest gets pulled up, it influences the pelvis. So the number one thing we can do in postural restoration is eliminate the overactivity of the neck, which then allows us to work with the lower body. So I would have someone stay in that position for 15 to 20 minutes. Just breathe in through your nose, out through your mouth. Focus on getting all the air out, as much air out as possible. Pause for 3 to 5 seconds. Inhale again. Back stays flat, chest expands, your neck is in a position that it's kind of deleveraged, so your brain can't use it, and we're hoping that you refine your diaphragms. Now, just doing something like that is often enough to get someone to pass their pelvis test, where the leg is supposed to go down, the adduction test on the left. Oftentimes, that's enough to get that test to change. But all that means is the test changed. You're not stable or anything. It's just it's a return to a more centered state. Now, after getting the neck out of the way, what would I try to do? Well, the first thing I would try to probably do is I would then try an actual pelvis repositioning technique, which I'm going to show now. This is the 90-90 hip lift with hip shift. It is, again, a postural restoration technique. It is very similar to the one, some of them that they were using in the study itself. So I would then do this, and I would see how things go. Just a note of caution, because the 90-90 hip lift with hip shift has a hip shift involved. This is where people who have very unstable pelvises or are still in a great deal of discomfort or pain, if they try to hip shift, which they definitely need to do, they're kind of in a catch-22. But when they try to hip shift, they end up using their left lower back muscles or their hip flexors instead of their hamstrings and their adductors. And that can actually cause more discomfort. So you have to really be careful with hip shifting when people are in still acute phases of pain, or if they're very, very unstable and they don't know how tight they are in other areas. They'll try to hip shift, and because they can't do it correctly, they end up using their left lower back or their hip flexors, and that can set off symptoms. I have a ball. A roll of toilet paper works well. You do not want to use a foam roller. You do not want to use a yoga block, a small ball, or a roll of toilet paper. You gently push your heels into the wall, then you pull your heels down into the back of the shoe, and then you just lift your butt up. As your butt comes up, you should feel your back push down into the floor more. And then I'm going to do the hip shift. The feet do not move. I shift my hips. You can see it, and I'm going to show it again. The right knee goes up, the left knee goes back, and my whole pelvis turns to the left. Now, I'm going to take my right foot off the wall, and I'm just tapping my toes. But notice my whole leg is moving. My right leg moves towards me, and then it moves towards the wall. I'm pulling down through my left heel. I'm feeling my left hamstring because I'm squeezing with my left knee also. I feel my left inner thigh. So the objective is to turn your pelvis to the left. I'm using my right leg. It's moving towards me, which is basically my right hip flexors, while my left hamstring is anchoring me. You're using the left hamstring and the left adductor to pull the pelvis back on the left, while the right side, the right leg, is forward. The right side of the pelvis is forward. That is the first step of any postural restoration program. Well, it's not the first step. It's the first goal. Besides turning off overactive muscles in other areas that are holding you over on your right side, you have to get over to the left side. And this is a technique that can be used. You would do the same thing, same breathing technique, in through your nose, out through your mouth, about 3 or 4 sets of 5 breaths. And then I would retest. Now, again, you don't have people testing you unless you see somebody in person. That's why I highly, highly, highly recommend you find someone. If you're in the United States, it's a lot easier, that you find someone who can help you with this, because you don't have the testing to tell you, did this work or not? But ideally, you would feel your left hamstring closer to your butt. If you feel it behind your knee, if you feel your calf, if you feel your quads, your hip flexors, if you feel anything other than your left hamstring and your left inner thigh, it didn't fully work. Well, let's just put it, let's say it probably did not fully work. Now, when it doesn't fully work, it's not because the left hamstring is not strong enough. It's not because the left hamstring can't work. It's usually because it doesn't have the opportunity to work. I've talked about having the right shoes. You cannot have minimalist shoes. You don't want to do this barefoot. I've talked about this a million times. I'm not going to go into it. Good sneakers. But when you cannot feel the left hamstring and you cannot feel the left inner thigh up towards the pelvis area, it's usually because something on the right side is not letting go. And those areas are usually going to be you're somewhere in the right posterior hip or the right side of the rib cage, and we have techniques for that also. Now, in this position, because of how I'm seated, my right side, the right side of my rib cage, is lengthened and expanded. I just sit my left knee is in line with my left hip. And I do the same breathing technique, in through my nose, out through my mouth. I'm just trying to feel expansion. I'm trying to breathe air into the right side of the rib cage to help inhibit or tone down the right lat, the right pec minor, the rib cage, the muscles, the intercostals, which are kind of rib cage muscles, even the right QL. Now, if I see someone in this position and their right knee is up in the air, that usually will indicate a right inner thigh and a lower right glute area, and yes, a right hamstring. This lower right quadrant area, and that usually needs to be stretched out also. So I would just do maybe 2 or 3 sets, 3 sets of 5 breaths in this position, and then I would move on to this lower right glute max inhibition technique. So now here is the lower right glute, right adductor, little bit of right hamstring inhibition technique. You'll see that I'm on my hands and knees. I cross my right leg in front of my left. And then I just breathe. I think about breathing into my back. My right leg is in an externally rotated position. My left leg is as far back as I can get it. Now I can accentuate it by going or change the angle if I go down onto my forearms, and then I can actually kind of slide my left leg back a little bit more, and I start to feel a little bit more stretched. My left hip is lower than my right, so I let my left hip drop down a little bit, and you just hold that position. You could do it again, a couple sets, 2 or 3 sets of 5 breaths, and that will often free up the right side of the pelvis and allow it to then come forward. Now, if you didn't understand what I just said, remember, in this left AIC pattern, the left side of the pelvis is forward, the right side is back. So that right lower glute area, the right hamstring and right adductor, might be holding this right side of the pelvis back, but we need it to come forward so we can turn the pelvis to the left. So that's what this stretch could help do, is before you start to rotate over to the left, it might not go all the way if this area, these muscles are still holding it back. So you can do this inhibition technique, and then when you try to hip shift to the left with the hamstring and the adductor, it will have an easier time to do so. Now here's one other technique, because the rib cage needs to go into a flexed position so you can expand your back with air, particularly on the left. So I'm just pushing my arms into the wall. What I'm not doing is elevating my shoulders, because that would be your neck. We don't want that. When you push yourself back, and your back is rounded and your pelvis is tilted backwards, so you're in a posterior pelvic tilt, I'm sensing the left heel, the heel of my left foot, the arch of my right foot, and I'm just trying to breathe so that I feel my rib cage expand backwards. And that's important for particularly the left side, because that supports or allows for a body to fully shift over to the left side. So that's another technique that could go in this sequence of techniques, or this overall really beginner program that can help get things started. Remember, you want to get help. You want to seek help. These techniques might not be perfect for you because you might be in a different situation than the average person. If you have any dental issues, if you're not wearing your glasses, if you have a really strong forward head posture, these things might not work. So if you're hypermobile, these things might not work. If you're really, really flexible, these might not work. You might not feel any muscles properly. There's a lot of different reasons. The underlying patterns are the same, but the reason that someone is patterned, besides the fact that they're right dominant, the reason that they're being held in such a compromised position can be different for different people. And in postural restoration, we know all the different reasons why it happens, but the average person just watching these videos is not going to necessarily know. Nonetheless, you can try these techniques. You never want to do anything that's making you feel uncomfortable. If you feel tension, if you don't feel the right muscles, it simply means that your neck, your lower back is not letting go, and you really can't power through it. You do not want to do that.